Welcome everyone. I'm Karen Richardson. I'm going to be talking to you today about the thyroid gland. The thyroid gland is a very large butterfly-shaped gland that is found right here on the anterior of your throat, right anterior or in front of your trachea. And of course the trachea is your windpipe. You have two lobes, one on the right and one on the left, and it's connected by an isthmus. Just as a small piece that's going to connect the sides. This endocrine gland is going to produce three hormones that we're going to talk about today. And it's the only endocrine gland that is solely functioning to produce hormones. It doesn't have any other job. Now, if we look at this, it's going to be important to get a good understanding of what the tissue looks like. So it is important for you to look at the microscope slides and to understand how this thyroid is producing these hormones. As we said again, there are going to be three of these hormones. Two of them are considered thyroid hormones. Okay. Now, if we look at this, we see what looks like clusters of cells with a clear area in the center. So these clusters are called a follicle. So a follicle is simply a group or cluster of cells that produce something. If you look closely, you're going to see that there's little small cells around the edges. And we're going to call these follicular cells. Of course, they get their name from being around the follicle. And again, the follicle is a ball of cells. In these pictures, you're cutting straight through them. But you have to remember, it's like a totally little ball of cells. And they produce the hormones and secrete them into the center. And this center area here, this colloid, is this gel-like material. It's a thick, sticky, amber-colored gel that's going to be made up of these hormones that are being secreted into the center. Now, what we're secreting is something called thyroglobulin, which is the inactive form of our thyroid hormones. All right, and again, we have two of these. Okay. Now, also, that was just two of the three. The third hormone is calcitonin. All right. Now, calcitonin is also produced in the thyroid, but it's by something called parafollicular cells. And you're going to find them out here in the center. Para means around or about. So we're going to have these in between the follicles. So that's where they get their name, parafollicular cells. Now, calcitonin's job is to decrease calcium levels in the blood. And you're going to hear more about that in more detail when the parathyroid gland is discussed. But for now, it's going to be important that you understand that calcitonin is one of the three hormones produced in the thyroid gland, and that you know it's coming from these parafollicular cells. You do not secrete calcitonin into the colloid. Okay? So that's the main thing that I wanted you to get from at this point about calcitonin. Now, if we look at the thyroid hormones, from here on out, I'll just simply be referring to the thyroid hormones. We're going to be talking about these two. T3 and T4. And it's much easier to think of them as their abbreviations, T3 and T4, because the real names are quite long. Tetraiodothyronine, triiodothyronine. Now, both of these are requiring iodine in the diet to be active. Nowadays, we get most of our iodine from salt. We have iodized salt. And as most of us know, salt is in almost every food we eat. So, we get this in the diet and we activate these. And that's where these words are coming from. There are, tri means three, so triiodothyronine means it has three iodines, and then tetra means four, so that's where the four is coming from. And again, it's going to be much simpler if we refer to these as T3 and T4. Now, if you go back to your pituitary gland, when you learned those hormones, you've already heard about TSH, thyroid stimulating hormone. So, anterior pituitary produces this particular hormone, which travels to the thyroid gland and signals the thyroid to release the thyroid hormones. All right? So you should already know a little bit about that. Now, as you learn about hormones, you want to always keep in mind what they do. What do they target? What are they going to do once they get there? So when we think about the thyroid hormones, we know where they're produced. Obviously, they're produced in the thyroid. We're controlled by the thyroid stimulating hormone, and we're going to target basically every cell in your body, all cells. Now, table 16.2 in your book has a really nice list of all the effects, and you're going to see there is a lot of effects from the thyroid hormone. So, if we look into this and we try to keep it very basic, very simple, the first thing that you need to think about when you think about thyroid hormones is metabolism. So we want to increase the metabolic rate. When we secrete the T3 and T4, it's basically telling our cells to speed up, increase all these reactions that are going on in the cell. All right? So you're increasing the speed of all your cells' work. To do this, we need energy, so we're going to also increase glucose, fat breakdown. We're going to up our usage of these things. If we do this, if we speed up and increase some of these enzymatic reactions, we're going to give off heat, which tends to up our body temperature, so we get warmer. So this might be good if you were out in cold, right? All of these are needed for just regular growth and development, especially the nervous system. Okay? We definitely have an effect. When we look at some of these disorders later on, you're going to see that if we get too much of these thyroid hormones, we're going to get a person who's nervous, anxious, they can't sleep, they're having mental problems, nervous system type problems. Whereas if they don't get enough, they're tired, sluggish. So you see differences within the nervous system. Now, all of these things are working closely with growth hormone as a person develops, because we want these cells to be stimulated to increase their rates while you're growing. Now, we look back at the histology, we look back at our follicle, we know what colloid is now, we know that this is what's stored in the center. Thyroid is interesting for another reason, because it is one of the only ones that can store something anywhere from 2 to 3 months. We want to be able to store our hormone because the body cannot live without it. Now, one of the reasons is that you might not be able to get enough iodine in your diet. So if we're able to store this for 2 or 3 months, we can kind of balance out this need until maybe you are able to get enough iodine. So basically the body's able to store this for a while. And again, this is our inactive form that's being stored here. And again, I said that we needed iodine to activate it. Now let's look at the steps that are going to occur to do this. What we have over here is a nice picture. This is our follicular cell. All right. Here's the colloid, and here's our bloodstream. So the first thing that's going to happen is the follicular cells themselves are going to produce thyroglobulin, which is our inactive state. They are going to push it into the center of the follicle, and it waits. And of course we have to have iodine. Now you supposedly ingest the iodine in your diet. It's going to be absorbed into your bloodstream and carried throughout the body. And when it gets here, these follicular cells are going to actively pump this into the follicular cells. And of course, to do this, we need ATP. Anytime we are working against a gradient, normal things want to balance out. We want diffusion where everything equals out. But here we're actually trying to increase the levels of iodine to 30 times what's in the blood. So to do this, we're going to actively pump it into the cells, and we're going to need some energy. So we use ATP. We pump that all the way into the colloid, and then we add it to these thyroglobulin. If we add 3, we end up with T3, T4. You have 4 added. T4 is actually the one that we do the most of. We produce more of T4. And again, everything waits until TSH comes along. TSH is going to be the stimulus that causes the release of these stored hormones. Now let's look at a normal, healthy person. From very early on, you learned about homeostasis. We learned that this was a balance, that we don't want too much of something and we don't want too little. So when we're talking about hormones, you've already heard that hormones, the majority of them are regulated by negative feedback. Now, let's look at this normal, healthy person. If for some reason we don't have quite enough T3 and T4 in the bloodstream, the blood is going to be monitored, and we're going to pick this up here. The pituitary will then release some TSH, which tells the thyroid, I need a little bit more, so it will turn out more T3 and T4 until we've got balance achieved again. And remember that when you're dealing with these hormones, the follicular cells have got to have the specific receptor for TSH or they won't respond. So hormones are very specific. No other cell in the body is going to respond to TSH. Now, on the other hand, in a normal, healthy person, if the levels become slightly too high, we've got to correct for that as well. So negative feedback is going to occur. Okay? Again, most hormones are controlled by negative feedback. Only a few are controlled by positive. So when this happens, for some reason, T3 and T4 is just a little bit too high. We're going to sense this here in the hypothalamus and the pituitary, and we're going to stop. We're going to decrease or lower the TSH that's being produced. And when that happens, that lowers the amount of T3 and T4 that's going to be released. So again, we're going to balance out our levels until we get back to normal. Now, obviously things can go wrong. Now, before I was talking about an average normal person. When we talk about some drastically out of balance disorders, we're talking about pathology. So when things go wrong with the thyroid, there are a couple of basic things you need to understand. This is a goiter. Now, a goiter is an enlarged thyroid gland. That is the simple definition. And if you look at this, there are several reasons that can cause this. It's not simply that you have too little thyroid hormones or you have too much. There's a lot of reasons. It could be a tumor here. It could be a tumor up here. It could be that you're not getting enough iodine in your diet, or your body could be attacking it. Several reasons. So as we go through this, it's going to be really important to keep in mind this very, very basic understanding. Hyper means too much, above excess. So hyperthyroidism means I have too many thyroid hormones, too much T3 and T4. So if I looked at the blood levels, I would see high levels of T3 and T4, an increase. And this is not something that that person can correct normally by those normal negative feedback mechanisms. We've gone beyond that. All right. Now, if you look at this person, symptoms are going to be this. You're going to have a person who's agitated, anxious. They may have lost a lot of weight because they're so hyperactive. Their heartbeat is up. Their temperature is up. They're going to be sweating. They may not be able to sleep. And yes, they may have a goiter. Okay? So those are what you see in the patient. That's not the cause. There can be several causes of this. So as you think about this, you want to keep in mind all these things that you're learning about the thyroid. So as far as the causes go, you have a person who's definitely got hyperthyroidism. So you have to think about why. One of the reasons is a tumor. All right? Now, cancer itself, cancerous cells, there are two basic kinds. Now, a proliferative type of tumor, this means that the tumor cells are overproducing something. They do not know when to stop. So you're going to have this thyroid gland with a tumor that is producing lots of T3 and T4. Again, too much T3 and T4 is simply hyperthyroidism. The reason would be this tumor that is overproducing. Okay? Now, if we put a tumor up here, let's say we had a large tumor up here that is producing lots of TSH, we've increased our TSH production. That means that we're going to be overstimulating the thyroid, and the T3, T4 also increase. So here we have levels. If T3 and T4 is high in the blood, it means you have hyperthyroidism. So if you notice, both of these tumors were proliferative, right? They were producing too much of something. And in both ended up affecting this, high levels of T3 and T4 in the blood. Now, the actual most common cause of hyperthyroidism is something called Graves' disease. It's a specific disorder. Again, you have the same symptoms, this nervous, agitated, skinny person who's moving around all the time, sweating, heartbeat. But you have one additional interesting symptom here, and it's a very obvious one. It's going to look like that person is staring at you. Their eyes literally protrude from the orbits, and you get what's called exophthalmos. All right? So that's going to be kind of a clue that you're dealing with Graves' disease. Now, the reason for Graves' disease, the reason that we've got hyperthyroidism, and again, what was hyperthyroidism? Too much T3 and T4, right? Which caused all of these symptoms. So the cause of Graves' disease is actually an autoimmune disease. And you have to understand a little bit about the immune system to understand what's going on. So you back up a second and you understand that an antibody is what your body is producing to attack something foreign. Usually we're going to produce antibodies to bacteria, the germs that we want to kill. But a disorder, an autoimmune disorder, says that my antibodies either attack my body or they cause something else, like what we're going to talk about here. Excuse me. LATs, long-acting thyroid stimulators. They are antibodies, but they act like TSH. So when they come in through the blood, they're going to bind to the TSH receptor and trigger that chain of events that's going to cause the release of T3 and T4, increasing my levels of T3 and T4 in the body. All right? So you're going to get hyperthyroidism because these follicular cells are being stimulated. They think that TSH is telling them to release and produce more. So you end up getting a goiter because we keep getting stimulation to produce more, for the thyroid gland to get larger and larger. Now the opposite of all that is hypothyroidism. This means we do not have enough. Hypo means under or below. Another word is myxedema. Of course, hypothyroidism is much easier. Again, if you can get this basic understanding of what hypothyroidism is, simply low levels of thyroid hormones in your bloodstream. All right? Again, many different causes, but if you check the person and their blood levels of T3 and T4 were low, they're hypothyroidism. Now these symptoms are very different. Here we got a person who's sluggish, they're tired, they don't feel good. If they're sluggish, they're not going to exercise as much, they may tend to gain weight. They're actually going to feel cold. Even though they got some insulation, they don't have that increased basal metabolic rate, right? So they're going to have this coldness. Their skin is affected. They're going to lose hair. So we've got a lot of symptoms. And again, this is, in a lot of people, it gets overlooked. You know, people tend to, this may happen gradually in some people. Now this is an adult. Now in a child, if you have a baby that's born in an area where there isn't enough iodine, or you have a malfunctioning thyroid, if the child doesn't develop with enough thyroid hormones, you get something called cretinism, which is a child that is growth development is retarded, mental development is retarded. Everything about this child will be delayed. Okay? Now, causes of hypothyroidism. Again, hypothyroidism is simply low levels of T3 and T4. Okay? Now we've got a couple of reasons on this slide that are working on this. And this one's pretty obvious. We got a big old tumor sitting on the thyroid, but this time it's destructive. So this is the opposite of proliferative. A destructive tumor shuts down production of something. So because this tumor is there, I can't make enough. So my levels of T3 and T4 go down. And of course that's hypo. Okay. So low levels. Now, another reason that we could be having low levels of T3 and T4 is up here in the pituitary. Let's say I develop this huge tumor up here that's destructive. And instead of making TSH like I should, I can't produce it at all. All right? So I have decreased my production of TSH. If I don't have TSH telling the thyroid to release, which is going to be low, then I'm also going to have low T3 and T4. So both of these reasons can be causes of hypothyroidism. And if you see this trend, you see that this is both destructive type tumors, whereas the proliferative tumors were causing hyperthyroidism. Okay. Now, in some areas of the U.S., there was a trend for thyroid problems and goiter development. And these people had hypothyroidism. They didn't have enough thyroid hormones in their bloodstream. And what was happening is they just didn't have enough iodine in their diet, typically within this area. And why? So if you go back to this and you think about that tissue slide I showed you about how we make thyroid hormones, we have to have iodine. And again, nowadays, we've had iodized salt for a long time. It's part of our culture now. We don't have to really think about it. But for some reason, say you have a patient that goes on a low salt diet and they don't correct for that, you might have someone who's not getting any iodine or extreme low levels. They can't make active T3 and T4. Now the body doesn't understand this. Blood level gets monitored. We see that we have low levels of T3 and T4. We're going to shoot out tons of TSH. We're going to increase our TSH levels. And what that does is stimulates this thyroid to get bigger, to try to produce more. But it's going to be inactive. We don't have any iodine. So the cycle is going to continue. Body senses we don't have enough, puts out more TSH, thyroid gets even bigger. So in effect, we keep getting this goiter development because we don't have any iodine. It's not that we're not producing the inactive form. We've got tons of inactive T3 and T4, but it just can't become active. So in this case, the goiter would be associated with hypothyroidism, in effect, due to no iodine in the diet. So of course, an easy treatment would be, of course, to include iodine in their diet. Now, the last cause of hypothyroidism is Hashimoto's disease. And this is another autoimmune disorder. In this case, this time, it's attacking the thyroid and causing it not to produce enough. We're actually going to destroy the thyroid. And in fact, if I destroy something, it can't produce T3 and T4, and therefore it's hypothyroidism. So if I look at this last slide, I put this one together that shows you both. Hypo and hyperthyroidism, there are two autoimmune disorders that can cause either one. The one I just mentioned was Hashimoto's. You have antibodies that can be produced that kill the cells. You have T lymphocytes that will actually attack and kill thyroid cells. And both of these paths are going to end up with a destroyed thyroid. They can't produce enough T3 and T4. And the result is we get hypothyroidism. Now the other autoimmune disease was Graves' disease, and it had a totally opposite effect. In this case, our immune system is pumping out all these antibodies that act like TSH. They bind to the TSH receptor, tell the thyroid to produce lots and lots of thyroid hormone, which is an overproduction, hyperthyroidism. So again, as you go through these, you're going to see that there are a lot of reasons for each disorder. So you want to make sure you get a really good foundation of how the thyroid works, what it's doing, what it targets, what its effect is once it gets there, and what is causing its release. You've got to understand the part the pituitary plays, the role of TSH. So all of this together, if you can start off and make sure you get really comfortable with the basics, then you start getting into the disorders. And it should be fairly interesting, I think, because you're going to see a lot of people with thyroid problems out in the real world. Well, I appreciate your time. Thank you very much.